It's your girl Betha, and I'm back again with another video. I hope you're good because I'm good. Okay, so today we are going to talk about dialysis access and then some complications that comes with it. Okay, first of all, what is dialysis? Dialysis is an option of treatment when you have a kidney failure, kidney problem. Okay, and so just like the kidney naturally brings out metabolic waste substances in a form of a urine, and then because it's been affected, it's not able to do that anymore, and so you need another option. Because if you don't have that, if your kidneys are not working, all the waste is going to be kept in your body, and you know what that means. You can probably die from it. Okay, so you need another option for bringing out all those waste in your body, and so that is why we have the dialysis. If you are not doing the transplant, then you have to do the dialysis. So dialysis, we have the dialysis machine, which has some parts. And as times goes on, I will show you how the dialysis machine looks like. And then on the dialysis machine, we have the dialyzer, which acts as an artificial kidney that washes all your blood and then brings out all the waste in the blood. And so before you can do your dialysis, you need an access to your blood. You have three main types of access for dialysis. We have the central venous catheter, which I mentioned in the previous video. We have the AV fistula, called the arteriovenous fistula, and then lastly we have the AV graft, which is called the arteriovenous graft. Okay, so first of all, let me talk about the central venous catheter. Okay, so for that we have the two types. We have the temporal and then we have the permanent. The temporal is fixed in your femoral, and then the permanent is fixed on your neck. Okay, and so for the catheter, they connect it under your skin. Okay, I'm talking about the permanent one right now. It's under your skin, through your chest or your neck. So like I showed you in the previous video, this is it, under your skin, through your chest or your neck. And then for that, you have to be very cautious about it. There are measures that you have to take to take care to protect it, so that you are able to still use it for your dialysis. The catheter, okay, is very prone to infection. The negative side of it, or let me say, the uncomfortable side of it, is that you can't bath like the way you can go under a shower and have a fresh bath. You can't swim. Water is not supposed to get to it. Why? Because it will get infected, and when it gets infected and then you are having your dialysis session, you're going to get rigors. Like when I say rigors, like chills. You're going to feel very cold. Like the weather could be hot, but then you're on the machine, and then you'll be shivering like really hard, really hard. And so that is why you have to make sure that water doesn't get into it. Okay, and you also have to always make sure that it's neat and clean. Yes, all that constitutes to infection, because when it's infected, there is this drug that you buy, vancomycin. I don't know if I got the name right, but it's really expensive. You don't want to have extra cost for treating infection. So all you have to do, your part to play, is to follow the rules that they've told you. Don't let water get to it. Keep it clean. Okay, and also the second one is the AV fistula, arteriovenous fistula. So we call it AV fistula. The AV fistula is a surgical procedure. Okay, is a connection of your vein and then your artery. It's a connection of your vein and your artery, because for the AV fistula, it requires a very high flow of blood. So the AV fistula is normally created in your non-dominant arm. Okay, and once created, you would have to wait for about 8 weeks. Yes, 8 weeks for it to mature and heal properly before you can use it for your dialysis. And for that too, you would have to be extra careful. Everything about this whole kidney thing, you have to be extra careful about yourself. Okay, you have to look out for signs like swelling, redness, and all that. It can also get infected. Okay, normally when it gets infected, your whole arm gets like really swollen, and you have to immediately contact your doctor to check it for you, because it can worry you. The other thing is that, okay, it can develop clots. When I say clots, like your blood can clot. Okay, so you have to always make sure that there is, for you to check if everything is in contact, everything is working. You have to check for a thrill or a vibration. So you put your hand on it like this. You are going to feel a vibration, very strong vibration. You can also put it on your ear and listen to a vibration. You hear a sound in it, like this. You hear it. When you do that and you can hear all that, then you know that your fistula is working. The other thing, the third one, okay, is the AV graft, the arteriovenous graft. For that, I have very little knowledge about it, but then I'm going to tell you what I know. Okay, that is also similar to the AV fistula. Okay, it's similar, but for that one end of a small hollow of the synthetic tube is connected to the vein, and the other end is connected to the artery. So for the AV graft, you have to take care of it just like the way you take care of the AV fistula. The AV fistula is the advisable access for every renal patient on dialysis, because it lasts much longer, for a very long period of years, than the AV graft. And then you know the infection that comes with the catheter. Okay, the AV graft is done when your veins are very small, because for the AV fistula it requires bigger veins, because it needs a lot of blood flow. Okay, so when you have small veins, like very small veins, that is when the AV fistula, the AV graft, comes in. The dialysis, we have two types, the hemodialysis and then the peritoneal dialysis. What we normally do here is the hemodialysis. Okay, so this is an image of how the peritoneal dialysis is, but what we do is the hemodialysis. Now, you guys anticipate for the next video. I'm so excited about it, so you should know it's really important. Please like, share, comment, and subscribe, and please turn on your how do I say turn off? So you guys turn on your notification button, because you wouldn't want to miss the next video. Should I give you a hint? It's going to be a story time. Yes, my journey so far as a renal patient. That is what we are going to talk about, and you will get to know a lot. Oh my god, I'm just hoping I don't get emotional. But please, thank you for watching this video. We'll be back again. I'll be back again. Bye.